Great. Good morning, everybody, and thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a couple minutes to click buttons to make sure that all the media who've joined us have permission to record. You will have permission to record this briefing, and we are also recording. That video will be on the Health District's website and YouTube channel later today. So just one moment. Okay, I think I've given everybody permission to record, but if you run into any problems, please go ahead and send a message in the chat box to Joint Information Center and I will get that fixed. We're joined this morning by Snohomish County Executive Dave Summers, Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will share their comments this morning, and once they've finished and wrapped up, we'll take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us, and with that, I will turn it over to Executive Summers.
Thank you, Heather. Good morning, everybody. Thank you for being here. Snohomish County and our partners really have worked since the beginning of the pandemic, day and night, to limit the spread as best we can of the virus and protect our community. So the increase in COVID-19 outbreaks we're seeing in schools right now is obviously concerning. I know Dr. Spitters will be addressing that a little bit more, but we've got to remember that COVID-19 remains a significant threat to the health and safety of our residents and is really a barrier to full recovery for our businesses and workers. So it's vitally important that we continue our efforts. Even with the increase in cases among younger people, though, only one recent COVID-19 case resulted in the hospitalization of someone under 19 years old. But as we know, younger people can transmit to older people, and so it remains a serious concern. So we're very committed to supporting public health strategies to continue to combat the pandemic, keep everybody safe. Most recently, we've invested heavily in Snohomish Health District to continue critical efforts like contact tracing, testing, vaccination, and outreach and education efforts. So just last month, the County Council approved our proposal to add another $10 million in federal recovery funds to the public health response to make sure that folks who need a test or vaccine have access to those. So we're, as I said, continuing to invest in public health. I've also asked my staff to explore any opportunities to partner with school districts to make sure families have swift access when the vaccine is recommended for all school-age kids. So we're looking at a number of potential strategies. This is a little bit of a new wrinkle with not clearly understanding how the demand will be for school-age kids and how that will roll out. There's private care providers and the private system, but we're ready to do what we can to help make sure everybody that wants a vaccine can get it. So just as always, urge everybody to get vaccinated for not only COVID, but now the flu vaccine is out. Wear a mask in alignment with statewide guidance is good for COVID and flu. And stay home if you're not feeling well. So continue all those safety efforts that we've been talking about for so long. It's still very, very important to do that. Those public health measures are really the best thing we can do to protect our most vulnerable communities, including our kids, but our seniors and others that are vulnerable. Those measures are vitally important. So we can do this. Let's keep going. And with that, I'll hand it off to Dr. Spitters.
Okay, thank you, Executive Summers, and good morning, everyone. We continue to see our case rates increasing for the second consecutive week. Through last Saturday, October 30, 1,672 cases were reported for the prior 7 days, up just a touch from the 1,581 reported the prior week. Putting those two together, we get 385 cases per 100,000 for the 2-week period ending October 30, up from 347 for the prior 2-week period ending on the 23rd. Hospital census with COVID patients is now at 57 countywide, 24 are on ventilators. That represents roughly 8% of hospital beds in the county. So that's improved, but much like the case rates, improved off the top of this fifth wave, but we're plateauing, or even going up a touch here at a much higher rate than following previous waves. I know many people are interested in the forthcoming plan for vaccination of children who are ages 5 to 11. As Executive Summers mentioned, not only is this important for their health, but it would help mitigate the impact of COVID on schools, quarantines, etc. And so we look forward to learning what the CDC's Advisory Committee on Immunization Practices will recommend for use of the vaccine in 5 to 11-year-olds following their meeting today. This meeting by CDC follows the FDA's authorization last week to extend emergency use of the vaccine down to children aged 5 to 11. They will receive a smaller dose of the Pfizer vaccine, but it's the same basic vaccine, same principle, and good safety and efficacy in the clinical trials. Moderna and Johnson & Johnson have not yet applied for extension of their emergency use authorization to include children. Should CDC proceed with recommendations, then, as you know, the Western States Scientific Group looking at vaccine safety and the State Department of Health then need to go through their steps to authorize vaccine providers to use the vaccine, and furthermore, to get it out in their hands. This is not the same formulation that adults receive. So it's the same vaccine, but in a different bottle and a different dose for the younger kids. So that has to get recommended, authorized, distributed, get in the places where kids will get vaccinated. And so although we may have a green light, so to speak, for vaccination as early as tomorrow, it'll probably take several days to a week for this to come to fruition in terms of doses getting into children's arms. Given concerns for patient safety and logistics, the mass vaccination clinics operated by the health district will continue to focus on initial vaccination for adolescents and adults and boosters for eligible booster recipients of all ages. Vaccination for children under 12 years will not be available through these sites. This again relates back to safety and logistics and following consultation with area pediatricians and a general consensus that somewhere under age 12, it no longer is really medically appropriate or feasible, we think, to vaccinate kids in a drive-through setting. And they really need to be in a seated setting that's a little more amenable to the special needs of younger kids. It's not like just vaccinating a tiny adult. There's a whole different set of issues there, as well as using this vaccination opportunity wherever it's possible to help the child get up to date on other missing vaccines and catch up on any out-of-date well child care. Rest assured that we have been working behind the scenes to provide an adequate network and resources for the approximately 75,000 children who will soon be eligible for the Pfizer vaccine. First, I just want to mention the recommended default approach. Like all other vaccines, parents can get their kids vaccinated through the healthcare system serving their child, if that healthcare system is a vaccine provider, and or at a local pharmacy. Most of the major chains, as you know, are providing COVID vaccines and will be participating in the pediatric lane of activity as well. We anticipate expansion of the state's vaccine finder tool to assist parents in this. And again, this permits an opportunity for updating on other vaccines and catch up on well child care that is not available through a mass vaccination clinic. Meanwhile, to create a safety net for children whose parents are unable to achieve vaccination through the usual mechanisms, the health district has been working with many school districts, pediatricians, clinics, and pharmacies to try to match them up for school-based clinics to reach children who aren't otherwise going to be able to access vaccine. We're look for information on that to emerge through your school system as that develops. We've also reached out to local pediatricians and pediatric clinics to understand their plans for offering COVID vaccines and where we can support them and fill gaps to reduce any barriers to participation they may be experiencing. The federal government is directly shipping vaccines to clinics and pharmacies, just as they have been doing since earlier this year. And at the health district, we are working on contingency planning to offer supplementary capacity to basically be the safety net for the safety net. But we want to make sure providers and pharmacies have enough supply for their patients and plans first. Quantities of vaccine forthcoming for 5 to 11-year-olds may be somewhat limited in the beginning as the manufacturer scales it up for nationwide supply, and then the distribution system gets it out to the branches of the tree for administration to kids. As we experienced in the rollout of previous vaccination efforts with COVID, like think of last winter, there's more demand than supply early. Then as that initial surge of demand gets met, things kind of calm down. So not everyone, though, is going to be able to get their child vaccinated the first week. It's just mathematically impossible. And if, we estimate that, let's say, roughly maybe 100,000 doses might be coming to the state for the coming week or so, and Snohomish County gets its per capita share of roughly 10%. That would be somewhere around 10,000 doses. And if we've got 75,000 eligible kids, let's say there's 50,000 whose parents are really excited about this, that's still going to take 4 to 6 weeks for many of those kids to get their first dose. So we urge patience and continued participation in the other prevention efforts through the community and school venues, all the items that Executive Summers mentioned, including, but not limited to, influenza vaccination, which can also make children and adults very sick and can exacerbate any hospital surge caused by COVID in the coming months. Just a reminder, if you make an appointment at one of the health district's mass vaccination sites, if you make that appointment for a 5 to 11-year-old, it will be automatically canceled. We will not have pediatric doses on hand at our mass vaccination clinics. Again, please reach out to your child's primary care provider and/or your local pharmacy once CDC and the Department of Health complete their steps in this process. And again, just want to urge everyone's patience. It's been a long time in coming. I'm sure you're all anxious, those of you with young children who are interested in this vaccine, but we just can't do it all overnight. And like previous efforts, it's going to take some time to phase it in. So with that, I'll turn it back to Executive Summers.
Great. Thank you, Doctor. First question is, statewide cases are plateauing and in Snohomish County case rates are rising. Why both of you think this is happening again? Doctor, do you know?
Well, this takes us right back to what we were talking about with schools, that at last look on our age specific data, meaning looking at rates by age group, all age groups over 15 are either, flat, horizontal, or still going down. But it's really been the younger kids back in school and, more contact, and probably more contact outside school as well. It's a different scenario than we had going last year. So there's more transmission. I don't think that should be a surprise. There's only been one hospitalization in a minor in the last month from Snohomish County. So this is sort of the cost of having kids back in school for in-person learning and trying to mitigate that with all the efforts that the schools are doing a great job doing. And And then vaccination will further mitigate that. But that's, sadly, I think that this increase in cases among school-age kids comes with putting them back together in school.
Doctor, the last numbers I saw, there were other places in the state where it was rising also, sort of concurrently with school openings. It wasn't just Snohomish County, although we seem to be a little ahead of the curve. Is that correct?
I'd have to look. I've seen, I saw the general statewide trend going horizontal, and I'd have to look. I haven't looked.
Okay. What's your message to parents who don't want to get their kids vaccinated?
Share your concerns with your child's healthcare provider. Consult reliable sources. Be careful about what you pick up off of Facebook, Instagram, that sort of thing. Try to look at reputable sites like university-based information, Centers for Disease Control, State Department of Health. And again, bring it up with healthcare providers, either that you know or that serve your family. And, remember that although kids don't get particularly ill from this, rare bad outcomes do occur, but this is all, also preventing transmission in kids is about preventing transmission to vulnerable adults elsewhere in the family or the social network, and trying to keep the schools running so that kids can get in-person learning.
I just echo that. Talk to your healthcare provider or doctor. Kids, school-age kids are used to getting a lot of vaccinations, and this is just another that we need now. So every bit of information that I've seen is that this is as safe as other vaccines and vaccinations that are out there. So it's important to protect the adults and teachers and everybody else that comes in contact with kids and just limit the spread. So vaccines will help us do that. So please. Let's see. Next question. Is there a difference in the dose for younger kids, say 5 to 8 versus 9 to 11, or do they get the same reduced dose? Doctor?
Same dose, ages 5 to 11. And it's about 1/3 the dose of an adult. Or, 12 on up gets dose X, and the younger kids get 1/3 that dose.
Okay. So a follow-up on the mass vaccination sites, doctor. So for the layman, can you explain why it would be inappropriate to have 5 to 11-year-olds come to mass vaccination clinics? Is there a concern that this decision could slow down youth vaccination uptake?
Yeah. Well, first do no harm. That's one of the things in medicine, and but also it's just yes. I mean, younger kids often aren't excited about getting vaccinated. Although I think more kids, I've heard, older kids more excited about this vaccine than any other. Those who are aware of what's going on and the benefits it could bring them in their life. But still, in general, kids tend to duck out and often need to be, sometimes get a little more tender loving care, or, calm, quiet, holding to keep them still. And also there's that, and that's just not amenable to doing something in a drive-through setting. Also, you've got the parent to deal with, not just the vaccinee. And often that's, counseling and having them help you. And that's just, again, this is not a good setup for a drive-through situation. And, it's really best done on firm ground. And, that's the general consensus of the pediatric care providers that I discuss this with, including vaccine experts. Reasonable minds may differ, but that's the way we're going. Safety first. And also, you mentioned, if there is a lot of chaos involved often in that with younger kids, and then if you have that going on in a string of drive-throughs, it's really going to cause bottlenecks. So it's just not a good setup for that. I don't really think that it should substantially diminish the pace at which we get this done. It's just going to be done through different venues. And there you have it.
Yeah, and as I mentioned, we're in communication with school districts and healthcare providers, and obviously the health district. And as this rolls out, we'll be looking at how the system's working. But we expect there will not be the huge wave that we saw with adults. But as Dr. Spitter said, there's better settings for administering vaccines to children. So, but we're standing ready to be nimble and help in any way we can to make sure this doesn't really slow down youth vaccination rates. Doctor, do you have any numbers on school children cases or cases in school children in the county?
Well, in school-age children, they accounted for about 20% of the cases over the prior 2 weeks, whereas earlier, if you go back the whole duration of the pandemic, they're more like 10%. So, their proportion of total cases is up for the 2 weeks. I think it was the 10th through the 23rd. They were 600 of the roughly 3,000 cases in the county. There's about 200 schools with one or more cases in the building. And thus far, we've had, somewhere around, I think through the end of September, there were 70 outbreaks. That means 3 or more cases in a school that appeared to be epidemiologically linked. The average size of those outbreaks was about 5 or 6 cases, very few larger than 10. And in the month of October so far, well, looking back at October now, there were about 20 outbreaks. So it came down a bit from the peak in September when the kids all came back. That's the general picture.
Let's see. Oh, and just note, we just put up a link in chat that provides the data by age and vac status for the county. So that's in your chat box. With cases going up, what else can be done to get these numbers to go down? Are there investments you mentioned earlier are the investments you mentioned earlier going to make a difference? And should schools be in person if that's one of the primary spreaders?
Well, I'll take a shot at that. I mean, I think that, we're not unmitigated victory over COVID doesn't seem likely to me. And so we're really transitioning into a phase of accommodation where the goal is to have vaccination and other prevention measures in place far enough to keep a lid on transmission and to mitigate severity of illness among the cases that do occur so that we don't swamp the hospitals. We don't have to close down classrooms or schools too often or workplaces. And we muddle through for the remaining duration of this pandemic, however long it will be. But I would say, the fifth wave is unlikely to be the last. We always want the current wave to be the last one. But, this could go on for months, even a couple of years more. And so we really need to. Yes, there are cases in schools. The severity of the outcomes has not been bad. The impact on the school administration and the efforts to mitigate, do all the contact tracing and such is huge. So vaccination will help there. And elsewhere in society, wearing our masks, at least for now and until transmission is down. And then when it comes back, we'll probably have to put the masks on, even when we're vaccinated. But we have to layer all these approaches to endure and maintain societal function looking ahead.
Maybe in a little different words, Doctor, and you please correct me if I'm off base here, but it's pretty evident, we've been saying this for some time now, that if you haven't been exposed to COVID or haven't had it, likely at some point you will. It's out there, it's out and about. And what we're really trying to do is one, protect people's health and save lives, and the vaccine is the best way to do that. The data shows very clearly you're in a much better place if you've been vaccinated in terms of your health outcomes. But the virus is spreading. It will continue to spread. We try to limit that, keep hospital capacity open, not get overwhelmed, and save lives. And so that's the kind of the mode we're in now. And I think the public health is always a balance, but keeping schools open, so far it's manageable. With the vaccine getting to younger children now, that should help in the long term. But again, there isn't a 100% victory in sight. It's going to be a long time for this just to play out, but we want to do it as safely as possible. So
agreed, 100%. Well put.
Let's see. Are other health districts across the state also deciding to not provide pediatric doses at mass vaccination sites? Is this guidance from the state?
I don't know. No, I discussed this with a variety of pediatric care providers in the county, a vaccine expert, and this is what we came up with. We'll certainly, if other venues offer drive-through vaccination to younger kids and it goes well, we'll take that under consideration.
Okay, WSHA's update yesterday discussed increased cases of young kids experiencing long-term COVID impacts. Is that being reported in Snohomish County?
Well, the things like long COVID are not necessarily, they're not really reportable conditions. So the hospitals and the pediatric care providers who see those kids are the best source for that, but it's not a notifiable condition. So we don't have any specific data on that. I'm unaware of an upswing in the per case severity or long-term consequences occurring and, having changed over time and becoming a greater proportion of affected children. It might just be that they're seeing more because we're seeing more kids get infected lately.
Let's see. No, that's not new. Any further questions?
Do a last call for questions.
You're welcome.
All right. Looks like we're out of questions, so we'll go ahead and wrap up for today. Thanks everybody for joining us, and please stay tuned for future media availabilities. Have a great day.